Welcome to Yoga Therapy, the Alchemy of Healing. My name is Marie Pampanin. I am your host. Please make sure to hit the subscribe button if you enjoy the information that we're sharing. Thank you so much for your support. Hi, Gemini.
I love to see. I miss you.
Miss you too. It is so exciting to have you on. Um, so today we are going to be talking about everything Gemini.
Oh wow.
Everything Gemini yoga therapy.
Oh, I like that.
So one of the questions that I've been asking everybody, because I think it gives everybody a good chance to kind of get to know you and your own journey, is what brought you to yoga therapy?
Oh wow, that is so funny when people ask that, even in general. So how the story goes is first I was brought to yoga. And that was through a fertility specialist. So me and my husband were trying to have a baby for a couple of years. And then I recognized that I wasn't recognizing that I was feeling some type of way about not getting pregnant. And going to one of the appointments, he said, you basically need to decrease your stress. Everything else is okay. And you might want to try yoga. And I'm like 30 something at this age and never at this time and never even nothing yoga. And so I went to a yoga studio and I said, I need to do one-on-one yoga. And the lady said, well, yoga really works better in groups. And I said, can I do it one-on-one? And she said, well, we happen to have a person in here who does more of a one-on-one yoga, and I'll get you set up with her. So she did. And so I'm in my yoga sessions. And by probably about the fourth session, I'm starting to think like I'm a psychotherapist. So I'm like, well, some of the things we're doing in here is like, but some of the things, the way she's speaking to me is how I would speak to a client. Right. And so one day we're in Balanasana or child's pose, and I start crying. Right. And I'm not really a crier, not in a negative sense. That's just not how I release emotion. And I looked up at her and was like, this is yoga? And she basically then explains how she's a yoga therapist in her second year program at MUIH and goes into the differences with me between yoga and yoga therapy. And so I said,
Mm,
oh, this would benefit my clients tremendously. And it was so crazy because
yes.
at the same time, I was starting to move into a different space in therapy, meaning when people were coming into sessions, Marie, I could feel what they would, sometimes even before they would tell me stuff, I would come out my mouth with stuff and I wouldn't know until I saw the client's expression or there was a release of an emotion. And I'm trying to figure out, well, what did I do? I talked to my partners at the time and I remember them telling me that was countertransference. So I was like, no, it's not. I know what countertransference is. That's not countertransference.
Mhm.
And so as I'm talking with the yoga teacher, she starts to explain to me the koshas, the
Mhm.
chakras, the yoga therapist, I'm sorry, the koshas, the chakras. And I'm like, whoa, this is what I'm resonating with. This is what I'm
Yeah.
feeling. So I said, well, what do I have to do to be a yoga therapist? So she says, well, you have to take yoga for a year, be practicing yoga for a year at least. And
Mhm.
then you become a yoga teacher, because that's what most programs for yoga teachers require. And then, you can go on to apply to be a yoga therapist. So I said, okay, I'm going to do that because that's how my brain works. This will help people. I'm going to do whatever it takes to help people. And
Yeah.
so I did find a yoga school. Excuse me, I did find a yoga school. I did yoga therapy with her for a whole year. And then
Wow.
I found a school who allowed her to write a letter for me saying that we did yoga therapy. And this teacher, who is now my mentor, uh,
Mm.
required that I come and take 2 months of her classes before I decided, because she knew the difference between a yoga teacher and a yoga therapist. And she just wanted to make sure
Mhm.
I knew what I was getting myself into. And I will say that I didn't. Because my first yoga class, I was like, this is a yoga. You got me up, you got me down. And it was a vinyasa class. And so I'm like, wait a minute. in yoga therapy, we might have done a couple of postures. I could tell you warrior one, I could tell you child's. We were doing stuff geared toward the root chakra, solar plexus chakra, all, for fertility. So that's what she was working with me on. That was my individualized treatment plan.
Right.
And so we're doing the yoga classes, and I'm like, whoa, this is a whole different thing. And so I did do that for a couple of months, but then I started recognizing how, oh, Jewel, you don't necessarily, Jewel is my middle name and what I call myself. You don't necessarily do your feelings, you move with your feelings. You know what I'm saying? I do the things. I don't necessarily at that time didn't allow myself to feel the things. And so taking the yoga classes helped to do that. And so then when I was done with yoga classes, I applied for MUIH, and that's how they found me. And so it was more a journey of me desiring to help other people because I could see how that had helped me. Oh, I have to give this back. And at the same time of doing yoga school for the 200-hour, I was also taking the medicine wheel to become a shamanic practitioner. So I had a yoga teacher who is a Buddhist. So I got a lot of philosophy and the 8 limbs of yoga versus mainly the asana. Like she did that and that was important. But what was really important is that I learned to live yoga because learning to live yoga would decrease my stress, would increase my ability to, at that time, which was the most important thing in my mind, have a baby. And so just that whole process was like, and then seeing how all things come together. I always say all things come together for the good, but to go from knowing that here to knowing that here, that's a totally different space.
Yeah.
So
you embodied it. You learned to embody it.
Yeah.
Through the 8 limbs.
Yes, Marie.
Yeah. Would you mind maybe going over the 8 limbs really quick as to how they worked with you and how you use them? So somebody who may not necessarily know what the 8 limbs are, they would be able to go, oh, okay.
Off gate. I know the first 2 is the main 2 that were important to me, the yamas and the yamas. Just those creeds of showing me how to move through the spaces. Then one of them is asana, but I think it's like the 4th one. And I thought that was amazing when I learned that, like before you could even, in traditional yoga, before you would even do a posture, you had to move through the yamas and the yamas. Then meditation, right? The ability to sit. And then the asana is really helping you be able to sit with the yamas and the yamas and the meditation and all the other limbs longer. That's the point of the asana. So after the asana, we get to a point, it more goes into the more subtle bodies, which to me is like yoga therapy. Yoga therapy helps with the more subtle bodies. And the final limb being like the bliss limb, samadhi, where you have this one pointedness, which is also to me like yoga therapy for economic well-being that we talk about when we talk about really what is the goal of yoga therapy, to reach a point of joy that is purposely and intentionally lived. We live a life like that.
Yes. To find that balance.
Yes. I remember Dr. Sullivan saying that to her, economic well-being is a life well-lived, well-intentioned. And I'm like, that is so true. Sometimes I even talk with my clients about that. We survive through life, but we do have the option to thrive through life. Not that it's easy, but I always say it's not impossible. And as long as something is not impossible, then it is something for us to hope for and strive for. So,
yeah.
I'm sorry to keep all the limbs down the road. I could if you want me to Google them real fast.
It's okay. I love like when people can just speak into things from an embodied position, because when we get too clinical, when we start, talking about the definitions, I think we can lose people.
Yes.
But when we come from an experienced, embodied position of how we get places, how we understand things, I think that more people can relate to that and they
And it
can
helps
most
us to meet,
definitely understand it.
yeah, and it helps us to meet people where they are, right? Because
Right.
how many people do you get to talk to that can pull from yoga, philosophy, yoga therapy? The average person is going to be
Mhm.
the average person hurting.
Right.
So,
Right. So you and I both have something in common. We both were in the mental health field before doing our journey into the yoga therapy field.
mhm,
So with you, you are also a licensed social worker.
licensed clinical social worker,
Yes. And you also do a little shamanic work.
practitioner. Yes.
Yes. So one of the things that I thought we can touch base on is how does that look, from a yoga therapy position um, in your wonderful studio called Haven.
Yes. So Haven Mental Wellness is my baby. It started from a desire to actually have an integration and coordination of care. So I started off my social work degree in dialysis. And in dialysis, I got to work with a physician, a nutrition, me as the social worker, and the care team of the people who work with the people on the floor. And just the ability of people to have that, all the different disciplines, oh, I just fell in love with that, right? And
Mhm.
so then I moved into private practice where now it's just me and one person. And for a long time, I would be like, and I would talk to the clients about, okay, do you talk to your doctor about this? Do you talk to the doctor about this? And understanding that a lot of people don't understand the importance of coordination of care. Um,
Yes.
and so then I was like, I'm gonna create something where it could be a one-stop shop, because I would hear people complain or not complain, but it's tedious, especially as you get older. And I work with a lot of older people and having to get here so many different appointments. And my brain just was like, well, what if I could create a space where there was you could get all the things, whole body. And that's when we're doing yoga and shamanic practitioner and even Reiki. That's when I started being like, we are separating out an entity that is meant to be looked at as a whole system, And
Yes.
so anyway, uh, when I got Haven, the building itself, Maria, I promise, God just started dropping all the things that I was speaking out loud in there. Because even though
Mhm.
I have all the degrees and can do all the things, can I technically do all the things? It's only 24 hours in a day. And is that good care for one person to be doing all the things? No, absolutely not. And so inside of Haven, we have me, and my role inside of Haven is a psychotherapist. I do teach yoga classes and I do offer yoga therapy only because where I live, we are limited in yoga teachers, and I'm the only yoga therapist.
Right.
But also in the space, I have another shamanic practitioner, so I do not engage in those services inside of Haven. I have another therapist to take over the caseload, and I have a yoga teacher who comes in and teaches yoga classes. Um,
Nice.
yeah. And so it's really helped to add in that disciplinary, integrative coordination of care model. And I am hoping to at some point add on a mental health nurse practitioner. I would love to add PT and acupuncture, again,
Mhm.
different doors to different parts of the human
Mhm.
with the understanding that talk therapy might not be from everybody, because at the basis, I am a LCSW first. I mean, I am a social worker. I live social work. And so that is always where I come from first. That's I would say that's who I am as a person, in general. And so having the awareness that that might not fit everybody and seeing that over the years, I've been practicing since 2006. So, and seeing that over the years, but let's say you come in for a regular yoga class and I notice something and how we talk and move, then that could get you a referral to maybe yoga therapy, maybe psychotherapy, maybe the shamanic practitioner, because it's different things that everyone needs differently at different times in their life.
Right.
So
I love that.
that's kind of how it all came together. Yeah.
I love that you spoke into this idea that it's not, you can't just give everybody the same care plan. We're all unique, we're all individual, and your yoga therapist will also be unique and individual depending on, their own background. But you also spoke about this idea of the multiple pieces. So the different koshas, we call them the koshas.
Yeah.
So the subtle bodies, where talk therapy might work, for some people, somebody who is in need of more, say, spiritual, care. They might want to either talk about religion and how it fits in their life, or see somebody who's a shamanic healer, or somebody who, and I love that you brought up, maybe possibly trying to find a PT, because, somebody who may be doing well in life, but they have chronic pain, being able to work with somebody who might be a little bit more specialized, in the physical body, but while working with, say, to work with the energetic body, right?
And that's one of the most beautiful things that I love about yoga therapy, because it
Yeah.
brings an awareness of what you might need at the time. And that's what I love
Yes.
about yoga in general. It's an invitation to have awareness to possibly decide what you might need when you might
Mm.
need it.
Yes.
I always say, if you have the awareness, then you can have the accountability, then you can create the action, and then you can create the affirmation, the
Yeah.
consistency of a practice, and,
Yes.
even when we talk about the stages of change, yoga therapy is perfect for that. Because let's say you come in and you're in your physical body, you don't even recognize that what you got going on mentally or emotionally is affecting your physical body. Because I always say to my clients, the body keeps the score. That is a beautiful book. And at the
Yes.
same
Yes.
time, you can feel it. Your body does literally keep the score. Okay, let's say you're only in your body. I can show you, like she did with me in child's pose, how you can move that physical sensation by
Hmm.
paying attention to your internal awareness. Or we could just move the physical sensation, and before you know it, you will be in your own internal awareness without even the
Right.
invitation. And so that part is like, I don't know. I think that's what makes me love yoga and yoga therapy the most, because there is a difference.
Hmm.
Yoga is, well, yoga classes. Yoga is all the things to me, let me say that. But when you talk about yoga classes or a yoga teacher, the things that they can provide, or scope of practice, which
Right.
is very big to me, is different than a yoga therapist scope of practice, which is different than my LCSW scope of practice, which is different than
Mhm.
my shamanic practitioner scope of practice and Reiki scope of practice. And as long
Yes.
as we abide within all the scope of practices, that is so important. Um, but a yoga teacher's scope of practice to me is not a limitation. It's just a different door, you know? And then
Mhm.
same thing with the yoga therapist. But of course, the difference is, an integrative assessment, an integrative plan of care. It's an individualized thing. So I was talking to someone earlier and they was like, well, yoga therapy, can you have a group for yoga therapy? And I'm like, yeah, you can, but everybody will have
Mhm.
the same concern, because everybody will have had an initial assessment.
Mhm.
Everybody will have had a treatment plan, and we're going to have the same type of population, like for stress, for hypertension, for diabetes, versus a yoga class. You could have a mix of all those
Yes,
things.
exactly. Thank you for bringing that up, because that is definitely the difference between, say, um, a certified yoga therapist that has the degree that is specifically like the degree that we have, which is more of a clinical piece, versus somebody who might be a little bit more traditional. I'm sure they do their own, paperwork, but one of the things that I think you might be able to speak into, especially having the social work piece, the clinical social work piece, right? in both of those, there's documented paperwork that we have to do.
Oh, my eyes got big. I saw my own eyes get big. I'm laughing at myself. Because yes, you know, versus LCSW and certified yoga therapist the same, there's a treatment plan that becomes medical, and it becomes a legal
Mhm.
document.
Yeah.
You talk about consents, um, initial assessment, consents, being mindful of HIPAA. Now you talk about
Mhm.
not only your scope, but now being able to be I don't want to say hurt, but in danger of possible legality when you don't be mindful of making sure you have all your things in place, creating
Mhm.
appropriate treatment plans and assessments and follow-up chart notes. Those things are
Yes.
real. So yes, I do. And I'm so LCSW trained. I have Reiki session notes. I have shamanic practitioner therapy notes. Everything has a note because where I'm from, if it's not done, if it's not documented, it wasn't done.
Right.
And so just as a good practice, but even having the understanding of the importance of that, when you go
Mhm.
to a yoga studio, yes, you sign a consent so that you have awareness that you're making sure your yoga teacher is aware of, any limitations, any physical conditions, but you're signing a waiver that's different than a consent for treatment. That's two totally
Exactly.
different. Yeah.
Yes. And with us, because we do have the clinical piece of it, that makes it easier for us to work in that integrated model. So we can say if you have somebody come to you and they're in PT, right?
Okay.
It does make it easier for us, for
Yes.
you, for all of us that have the integrate, excuse me, the clinical aspect of this, for us to be able to document, to become an integrated part of somebody's healing team. You have so many pieces already going on with you at Haven, but for somebody like myself, being able to document, and of course, with our client's permission, share and have these ongoing conversations with somebody who, perhaps is dealing with um, depression, but it's stemming from menopause,
Yep.
and all of the things, the transitional life things that start to happen. That gives me the ability to work with, say, if they're working with a therapist, to be able to talk to their therapist about the things that, we've said are okay to talk about, which makes our clients get more support in between different sessions because people are talking to one another instead of everybody just going, okay, this is my little bubble and I'm going to work within my little bubble.
It gives the language to help um, foster integration of care and coordination,
Hmm.
right? Because,
Yes.
like you said so perfectly, a PT person sending the clinical yoga therapist is different than how the PT is going to work with you. They're not going to speak to you regarding all the subtle levels, the emotional space, the breath, body. They might tell you to breathe when they pushing on you, but helping you understand why the breath is important and how you can
Right.
use the breath to not only
Hmm.
help mitigate when they're pushing on you, but to help move sensations, to
Yes.
help pay attention to the rough spaces, to use as a tool for mental health, right? And so to me,
Hmm.
that is the difference even in the different disciplines because there's
Yes.
differences in disciplines. And like you said, somebody coming even to me for mental health as a psychotherapist, I could refer them out to a yoga therapist when I realized that it would help to get them moving or doing a different type of thing versus talk therapy. Let me
Right.
give you an example. So right now, because we graduated and we done, I see a 15-year-old for yoga therapy. She was my first yoga therapy client. Do you know why? The doctor recommended her to come to me for yoga therapy, not psychotherapy, because she doesn't like to talk.
Nice.
Because she
Mm.
doesn't like to talk. She does not like to talk about how she feels, and she's rating high. She was rating high on these scales. And so he said he had heard somebody had told him something about me being in Haven and doing that. And he called and he sent her over, and she's been,
Nice.
and so the first thing she said, her mom said was, she don't have to talk. I said, no, she don't. But you know what I knew was going to happen is that through yoga therapy, she would
Yeah.
eventually learn to talk. But that's different than psychotherapy, where at first, if you're going to come in, we got to talk. You can't sit
Right.
across, you sit across from you, we're not talking. That's not
Yeah.
therapy. That's not talk therapy. But in yoga therapy, I did her whole assessment. She didn't have to say nothing.
Yeah.
I plugged little things in, of course, being me, things that I was noticing, and I could see her make a
Mhm.
move or do a certain thing. But now, 5 sessions in, she does talk. She doesn't
Mhm.
talk a lot, but what she does a lot is release. So she'll have an emotional release through the things that we do,
Mhm.
and not just movement, through journaling, through
Yeah.
awareness, through breath work. Just the invitation for internal awareness. That's all
Yes.
some people need, is an invitation. We live in a fast-paced, outwardly world. Go, go, go,
Mhm.
move, move, move this way. How often do
Yeah.
we say, "Oh, oh, oh, okay, self," you know? So,
It's so true. I actually have to remind myself quite a bit to stop, look inside. It was funny when you were talking about your introduction to yoga. My introduction to yoga was pretty funny because it was all about just moving through the postures, just moving through the postures, moving through the postures. I could not sit still to save my life. Like I just had to keep moving and keep moving and keep moving and keep moving. And what was interesting is that within, I want to say by even before our first semester was over at MUIH, I was doing somatic yoga. It was my first training for somatic yoga. And I was just like, oh, this feels so.
no doubt.
I could not get out of my head. I spent most of, in my head and like you said, you move through your body, you move through your body, you move. That's how I got the tension out of my body. But because I wasn't aware of it, I was holding in different spaces and that came through loud and clear, loud and clear.
I got that same lesson with like yin and somatic too, because I love
Yeah.
vinyasa too. I love a flow. Make me inhale once, exhale, and let me be moving the whole time, right? It's an
Yeah.
avoidance space. And when we learned about yin with Dr. Tracy Myers, I think it was,
Mhm.
I was like, oh, this is probably what I really need to be doing as a pitta. I don't need to be adding on more. And then realizing how, like you said so perfectly, uncomfortable I would be with, why is this taking 10 minutes? Like, next, and
Yeah.
aware, me and Kim talk about it all the time. And Stacy too, just the awareness of, paying attention. Like I said, that's what yoga
Mhm.
is to me. It helps bring the awareness of recognizing, what do you really need? It's an invitation. Everything is free
Mhm.
will. That's my favorite saying. But if you want to work on healing, I don't know if I feel about that word no more, but to me, if you want to work on becoming the best version of yourself, uh,
Yeah.
that requires work.
Yes.
Action requires some type of action. Whether that's
I love
mental,
that.
emotional, with your breath, that requires
Mhm.
action, a doing, a movement. Mhm.
Yes.
So,
And the wonderful thing about working within a yoga therapy window is that, or lens, is that when we work with people, it's going to be very different. Somebody may need to do more breath work, or they may need to do more movement, while somebody else might all of a sudden have an understanding of this emotional release as they're just laying there.
in there, literally.
And we get to work with them and meet them right where they're at. And that's the most amazing thing to me about yoga therapy.
That's
It's just
it.
being able to meet somebody where they're at.
Yeah. in the moment that they're there, you know?
Yes,
Yeah,
yes.
in the
And it
moment.
changes from, I want to say, from session to session or day to day, moment by moment. And again, that's another piece that we get to be aware of. We don't
Yeah.
have to go back and be like, well, last week. It's like,
Nope.
where are we today?
Where-
Because what we look like today is going to look very different than tomorrow or what it looked like yesterday. So,
And yoga therapy has even helped me in my yoga classes because having the awareness of, from the form that people fill out to say, yes, I'm aware of bong bong bong, different than the consent. Now I would
mhm,
pay attention to everybody's body and inviting the invitation, my invitations in class, because my yoga is called Mind Body Wellness, yoga for mind body wellness, is notice how you feel. Everything I say after it is, how do you feel? Notice from one side to the next side how you feel. Notice from one breath to the next breath. I love saying now that things are from one breath to the next breath. If we could just be
yes.
mindful of that,
Mhm,
if we can start to bring that active awareness of that, so many things would be different. Once we learned
mhm.
in the program that stress was the number one cause of so many different ailments and diseases, it like
Yeah.
hurt my feelings because I also
Hmm.
feel like it's the number one thing that we can control.
Yeah.
So this number one monster is not an intangible monster. It's not something that we don't get to affect. We get to affect
We
it.
do. Yeah.
That was just like,
Yeah. Really.
I feel
That was
right now.
definitely mind blowing. Yeah. It's like, oh. Because
Yeah.
I think when we do work with people, from one aspect, so we'll just use, psychotherapy, for instance, right? We sometimes will miss these more subtle things that we need to work with people on. I work with people that are transitioning from um, incarceration to, you know, life out in the normal world, right? Which is very different. And one of the things that, we're working on right now is the breath work, and getting them to feel and sense into their bodies because so much of what they're living, and they may not even realize this because they're disconnected from their bodies, is this sense of heightened, um, need to take care of themselves, right? Fight, flight, right?
Immediately.
Survival mode. It's
Yes.
survival mode, and when we get to meet them in that space, we're creating a window of healing. And like you said, if we could just take that out and expand it, and I've said this actually many times in the different podcasts, you know, it starts with us, but it radiates outward. This everything that we do, I mean, they knew the rishis, they knew, like they understood, you know, it's an outward effect. It goes beyond us. We
Absolutely.
start and we move out.
Yep. That's so true. And it was, when I think about my love for God, Jesus, and the Holy Ghost, because I always say that,
Yeah.
that to me is how I connected when I used to pray as a little girl. I want to be a light for you, God. I used to always say that. I want to be a light for you, God. And then I realized, how do you be a light for God? Oh, I have
Yeah.
to pay attention and turn on the light for my own self.
Yeah.
And then that light gets brighter. And then other people see that light. And then they have questions about my light. And then I can
Mhm.
tell them about my light. And then they have the
Yeah.
invitation to now go inward and clean out their stuff so their light can burn brighter. I always say the heavy lifting, yeah, that's the work. The result of the heavy lifting is you burning brighter because now you don't
Yes.
have all that gook inside. And when you burn brighter, you can attract some of the darkness that needs the light or that wants the invitation
Yeah.
for light. And that is how I get to be a light for God.
Yeah.
See how
That
it all.
reminds me. I had my personal the woman that I work with, she asked me, she said, she goes, "Do you want to be a candle?" She goes, "Or you want to be a lighthouse?"
Oh, I love that.
Yeah. I keep saying it in my head in those days of, because of course, even though, we do our own work, we
Yep.
still struggle. I mean, we still have the
Yeah,
thoughts and the life that we still have to exist in. And so one of the things that I do, always hold very close to my heart is, am I a candle or am I a lighthouse? You
and
know?
sometimes I'm a candle because I need to be. And
Mhm.
then when I really want to be in my space, I want to be a lighthouse too.
Yeah.
Mhm.
And I think, it was interesting because when she first said that to me, one of the thoughts that came across my head was, well, what's the difference between a lighthouse and a candle, right? And you said sometimes, you want to be a candle versus a lighthouse. And that takes me back to another woman that I heard once. She's a pastor, and I can't think of her. Oh, Joyce Myers. And
Oh,
she was saying how, in one of her sermons, she was actually saying that, she gets up and she talks to all of these people, you know, and that is one way to affect the world. But then there's other people. It might be one person, but when you talk to that one person and that person, right? Exactly. And so in my mind, it's like a light is a light is a light, but I want to remember
what is my
my
purpose?
lighthouse.
Yeah. What is my purpose?
Don't dim my light.
I'm like, what is my purpose? Where I'm at, where am I at on my journey? Yep,
Yeah,
absolutely.
exactly.
Absolutely.
Exactly. Yeah. I see
So,
the light. The light, it's kind of funny because behind you, Gemini, the light is coming through
oh, for real?
on the wall. Yeah.
And I'm in my prayer room because you already know that from school. I wanted to be in
Yeah.
Haven so I can show you my little nook, but the yoga teacher has class today, so I had to come home.
Nice. So, just out of curiosity, if we were to just walk into your studio, what would we see? What would that look like?
So when you come in first, you're greeted by my office manager. And then there are two doors right there, in addition to the yoga floor. So the yoga floor is right
Mhm.
there when you first walk in. And then the other therapist who does mental health counseling, she's right there. And then the other shamanic practitioner is right there. She's also getting ready to go back to massage school. So we'll have a masseuse in there.
Nice.
And then
Awesome.
on the other side is my office where I do psychotherapy. And there's also a infrared salt sauna because I did
Mhm.
get a salt sauna too because of the benefits of the salt with the immune system and respiratory issues and the community that I live in. It was just like a good fit, I felt like, for the wellness space. Um,
Nice.
there are also two bathrooms. I have a waiting area. When people walk in, they say, it feels good in here. And I love that because I put
I
my
love
heart
that
in
too.
here. My heart chakra is all throughout
Yeah.
that building. Everything is purposeful and intentional in there. We even have a smell. So when you walk in, Keisha Adinkra created a smell for Haven mental wellness. And so when people walk in, they always say, it smells good and it feels good in here. And smell is part of senses. You know,
Yeah.
my goal was to create Haven to be a safe space, as a
Right.
therapist, as a human, as a woman. Safe spaces are important to me. And so when there is safe space, it gives a person permission to even think about going there. That's what I have learned. If you can help somebody to feel safe, in school they called it healing presence, right?
Mm-hmm.
Um,
Yep.
if you can create that safe space, that is literally half the journey. And that's the
Mm-hmm.
honest to God truth. And so my space is for the whole community. I serve people from 5, I always say, to 95. My oldest client is 95.
Nice.
With all from all spectrums, Some people think of therapy as just mental health, which is true because that's how we describe mental health. Grief is mental health, loss is mental health,
Yeah.
um, loneliness is mental health. All those things affect mental health. Being overworked, overburdened, overwhelmed, all those things are mental.
Yes.
And so sometimes people just need a place to be. And like I said earlier, whether that door needs to be with yoga, yoga therapy, psychotherapy, come sitting in the sauna, I wanted to just create a space. Even we have an aromatic space in there as well. So once you come into Haven, on a little skirt of Haven is a whole store with aromatics of the woman who created the Haven scent. And
Wow.
we talk about how we create and touch all senses. Again,
Yeah.
whole person, all the things that the whole person has and affected by. People come in with trauma and you could be affected by a smell. You could be affected by
Yeah.
the lighting. You could be affected by the sounds in the building, right? And so just trying to be very mindful of that because you never know when somebody has trauma. People don't walk around with trauma stamped on their forehead. And trauma to one person is different than another individualized thing because it
Yes.
is individualized. Emotions are individualized. And just having that
I love
awareness
that.
intentionally. It's that intentional
So,
awareness.
yes, intentional awareness. So, if somebody wants to just come in and take a yoga class, is that okay?
It is. We have classes 3 days a week. I teach only on Tuesday nights because I do try to do a little bit of everything. So I teach Tuesday nights. Keisha teaches the other nights, Monday, Thursday, and then a Saturday morning. Um, we do have walk-ins, we do have appointments. Like I said, because of where I live, I try to do both. I offer virtual as well. So I offer in-person things and I offer virtual things as well. So I try to be able to, reach anybody where they're at, just thinking about, all the
Yeah.
things that I've been through in COVID and, just the things that I see people present with trying to be, so nobody can say, I can't do that because every time somebody said, like,
Yeah.
I can do virtual. I'm the type person, I'll come to your house. Is it more beneficial for me to come to you and provide services there? Because it might be, because we live in a rural area. So you might can't get to me because we don't have buses and
Mm,
transportation easily like that. So
yes.
yeah.
So, where are you exactly?
I am in Elizabeth City, North Carolina. So I always say I'm 45 minutes from OBX, from the Outer Banks. And then I'm also 45 minutes from Virginia Beach. So I'm like in the
Nice.
perfect little nook space. When you talk about North Carolina, I'm probably about 2.5 hours from Raleigh, but I'm more on the East Coast. Raleigh is more inland, and probably about 5 hours, 5.5 hours from Charlotte, North Carolina. Those are the bigger cities that people know. So I'm not too far to either. I actually go to all of the spaces all the time. Mm-hmm.
Nice. So, is there anything else that you would like to share that you do?
Um,
Your hopes, your dreams, your aspirations?
oh my gosh. Okay. So my hope is to create this beautiful wellness space where all persons can come and get what they need. I'm a Black owned business, and where we live, I love to be a role model to see that you can do all the things, no matter what it is. So I'm glad that I'm offering that in the space where I'm at. Um, Actually, my building is a historic home. So I'm in historic
Oh,
downtown Elizabeth City, and my
okay.
building was built in 1940, I believe. 1940, I think it is. So we were recently
Nice.
named a historical building. Um, and wow, like I said, nurse practitioner. I would love PT and acupuncture. None those things. We have PT in our town. We have a couple PT people, and I've been in talks with them. We don't have acupuncture. I
Mm.
am in Elizabeth City, one of two yoga teachers, one of three yoga
Wow.
teachers. And then you go to the outskirts of Elizabeth City, and there's one more who I love,
Okay.
Tammy in her studio. But yeah. And so just creating awareness, that is my hope. The awareness that there are different ways to get what you need to be your optimal self. I think that's my hope that I could leave, my legacy that I could leave behind. That people be like, yeah, Gemini helped me realize me. Right? Gemini gave me the
Nice.
tools to help me realize me. Because I don't do that. People do that themselves.
Right.
We don't do that as therapists. We say, here are the things.
Hmm.
You get to choose things. right?
Yes.
It's all about, to me, choice. People don't always realize that there is a choice. And that is important to me because I want people to know that they
Right.
have a choice. Mm-hmm. And then that's it. I love speaking and talking. I'll get to speak at BITA coming in August. I'm on the panel with Dr. Gail Parker, Dr. Miriam, and Sation, who's a mental health professional as well. And that's going to be cool. I'm actually also going to speak at MUIH, talking about the difference between yoga therapy and psychotherapy. So that's going to be cool. And I would love to do that. Really start going around and talking. Like, I love how you're doing your podcast. I'm so proud of you. This is beautiful. I've loved every podcast that I've seen so far. And so maybe not podcasting because y'all already know how I feel about this part, but really going out and speaking to audiences about yoga therapy, coordination of care. I am a medical social worker to my heart, you know. So having the awareness of how the different disciplines can work together,
Mm-hmm.
and how we really need to be working together to create a whole body health space. That is important to me. I'm blessed to have doctors in my area who I work with in dialysis who are intrigued by what I do, and they send me clients, right, for yoga therapy.
Nice.
So I think that's cool. And their awareness too about it and their desire to help their clients. I think sometimes that get lost in the medical model when you talk about insurance and all the things, you know, that can get lost. And so just being an advocate of that not getting lost, of us keeping patient or client care first and not getting lost. Yeah, that's what I would say.
Love that.
Thank
Yeah.
you.
It is easy to get lost, but I like to get lost in the weeds.
Yeah, it is.
Yeah.
So yeah, I guess that would be my little spiel. Thank you.
So, any parting words?
I would say the most important thing to me is that yoga has shown me how the body will do the things when we don't allow ourselves to feel the things. And when I say body, I mean whole body, you know, all the it's this who each individual is.
Nice.
And that's what yoga therapy can assist with.
Thank you so much for joining me today. I hope to have you back on and hear more about what you're doing with yoga therapy. But in the meantime, we'll have the information where people can find you in the show notes. And thank you for sharing with us where you are, what it would look like. That it sounds like everybody's welcome.
Everybody is welcome, all persons.
Everybody's welcome. That's awesome. So thank you again. This has been an absolute pleasure. Thank you.
Thank you, Marie.
Thank you for joining us today. If you would like to support this content, hit the like button, subscribe, or leave a comment. Thank you so much for joining us. Have a fabulous day.